Hi everyone, today I'll be going through the Action Research Arm test. I'll first introduce the client and her OPIs, followed by discussing consent, the environment in which the assessment is done, the assessment tool, and finally discussing results with the client.
This is Mrs. Geller. She's a 65-year-old Asian woman who was born in Malaysia in 1955. She lives with her husband in Melbourne in Box Hill, and she has 3 children. They have a beautiful garden where they grow fruits and vegetables. She and her husband do the household work, laundry, and grocery shopping together. On the weekdays, she and her husband go for a walk in the nearby park and do a longer, approximately 1 to 2 hour walk at the National Park in Victoria on the weekends. They tend to their herb, fruit, and vegetable garden. She and her siblings who live nearby cook dinner together at least twice a week. One of these dinners are of making dumplings, followed by dinner with the extended family. 4 days ago, Mrs. Geller had a right hemisphere stroke resulting in weakness in her left arm, which has affected her ability to do gardening and make dumplings. She wants to return to her gardening roles and making dumplings with her siblings. Consent will be taken using a consent form, and safety precautions will be taken to ensure she is safe to conduct the assessment. She will also be informed that she may stop the assessment at any time if she is uncomfortable. The assessment will be conducted in a quiet, non-distracting and comfortable room. The lighting of the room will be adjustable so that Mrs. Geller will be able to choose the lighting of her choice. The temperature of the room will be set to 25 degrees with the option available for her to adjust the temperature should she wish to. There will be a large table so there is ample space for the assessment to be conducted. A comfortable, adjustable chair with no armrest and a footstool will be provided so that she may sit comfortably and optimally to perform the test. She will be asked to ensure that she is able to reach the back of the box while her back is against the chair. The occupational therapist will either move around or sit across from her. The Action Research Arm test was chosen as it assesses upper limb function, in particular dexterity and coordination, which are important ability components in making dumplings. Identifying her performance through the Action Research Arm test scores will help to determine improvements in these areas pre- and post-intervention. The test was also chosen for its psychometric properties. I will elaborate more on this later. The ICF classification for the test is activity. And now we'll discuss the equipment needed for the test. The equipment needed are 4 blocks of varying sizes, 1 cricket ball, 1 stone block, 1 large and 1 small metal pipe, 2 plastic cups, a jar lid, washer, marble, and ball bearing. We'll now return back to the psychometric properties of the test. The test has excellent concurrent validity when compared to the Fugl-Meyer assessment, the 9-item version of the Arm Motor Ability Test, and the Motor Status Scale. It has adequate to excellent predictive validity and excellent construct validity when compared to the Wolf Motor Function Test. It has excellent intra-rater and inter-rater reliability, excellent internal consistency, and adequate responsiveness. However, the test has floor and ceiling effects. Now we'll discuss the 4 subscales of the test. First, we have the GRASP subscale, consisting of 6 items and the score ranging from 0 to 18. Next, we have the GRIP subscale consisting of 4 items with scores ranging from 0 to 12. The Pinch subscale consisting of 6 items, and finally, the Gross Movement subscale consisting of 3 items. The final score is the sum of all items in all subscales with a maximum score of 57, and the minimal clinical important difference in the change of scores is 5.7 points. The non-affected or less affected side is tested before the affected side is tested. In Mrs. Geller's case, the right arm is tested before the left arm. The GRASP subscale consists of 6 items. The first item on the subscale is grasping a 10 cm block. If Mrs. Geller is able to grasp the block, she scores 18 points for the subscale. However, if she is unable to, and she scores between 0 to 2 points, then we assess item number 2. If she scores 0 for the second item, she will not require any further testing and will score 0 on this subscale. If she scores between 1 and 3 points, all tests on this subscale will be required. The occupational therapist places the objects at the starting position, ensuring that they are aligned accordingly. In particular, the sanding block needs to be aligned in accordance with the palmar crease. The OT then says to Mrs. Geller, grasp the block that I have placed here, lift it up, and then release it on top of that shelf. The instruction is repeated for the varying sizes of blocks, the cricket ball, and the sharpening stone. The whole subscale is repeated on the left arm. The first item on the GRIP subscale is pouring water from one glass to another.
If she scores 3 on this item, then she would have scored a total of 12 out of 12 points on this subscale. If she scores 0 to 2 points, then the second item will be tested. If Mrs. Geller scores 0 on the second item, then no further testing is required. However, if she scores between 1 to 3 points, then all other tests on this subscale will be tested. On the pinch subscale, Mrs. Geller is told to grasp the ball bearing using these fingers, lift it up, and place it in the tin on top of the shelf. If Mrs. Geller scores a 3 for moving a ball bearing held between her ring finger and thumb, then she would have scored the full points for this subscale. However, if she scores between 0 to 2 points, then the second item will be tested. If Mrs. Geller scores between 1 to 3 points on the second item, moving a marble held between her index finger and thumb, then all other items on this subscale will be tested. However, if she is unable to do so and scores 0 points, then she will receive 0 points for this subscale. There are 3 items in the gross movement subscale. Mrs. Geller will be seated on a chair with her hands on her lap as shown in the picture. She is told, touch the back of your head with the palm of your hand. If she scores 3 points, then the score for the subscale is 9 and the test is completed. If she scores 0, then the score for this subscale is 0 and the test is completed. If she scores between 1 to 2 points, then all other items on this subscale will be assessed. The instructions and procedure is repeated on the left-hand side. Now that the Action Research Arm test is completed, let's discuss the next steps we would take. We would start by talking about the results of the Action Research Arm test before talking about possible therapies. As Mrs. Geller had a stroke, modified constraint-induced movement therapy is an option. The benefits and limitations of the therapy will be discussed with Mrs. Geller, keeping in mind the use of natural frequencies when discussing numbers. Visual aids, such as icon arrays, bar graphs, and take-home brochures may be used to help aid her understanding of what is discussed. Lastly, opportunities will be provided to Mrs. Geller to ask questions, or the occupational therapist might check if she understands all the information that has been provided by asking Mrs. Geller to provide a summary of what has been explained. I hope that this video has been helpful in understanding how to conduct and score the Action Research Arm test, the type of client it might be used on, and how to proceed once the testing is completed. Thanks for watching. Bye!